Hello and welcome to this episode of Health and You. I am Sumi Sukanya Datta, and in this episode, it's largely about the link between nutrition and diseases, especially because this is Nutrition Week. We are joined by top diabetologist and endocrinologist Dr. Anup Mishra. Dr. Mishra is a chairman of Fortis Center for Diabetes, Obesity, and Cholesterol and heads National Diabetes, Obesity, and Cholesterol Foundation. We also have with us public health nutrition expert Dr. Seema Gulati, who heads the nutrition research group at the foundation. Thank you so much, Dr. Mishra and Dr. Gulati, for joining us in this conversation. So, the
Thank you.
recently released dietary guidelines by the ICMR National Institute of Nutrition clearly said that nearly 57% of India's total disease burden is due to unhealthy diets. We will start by asking you, sir, because this is one area of research that you're really passionate about. So, what diet-related mistakes are Indians making, and there is nearly a diabetes epidemic of sorts in India, as we know, with a large number of our population, more than 10 crores, now being diabetic. Do you think this trend can be reversed anytime soon if we really rectify some of the mistakes that we are making?
Thank you. Number one, that this nutrition guideline is just a reminder. It is nothing new. I mean,
Right.
we have been knowing these facts for last 2 decades. That the problem with the nutrition, as far as Indians are concerned, is increasing, and
Right.
the imbalanced nutrition is everywhere. Whether you take urban areas, or you take suburban areas, or you take rural areas, and increasing rapidly, affecting all segments of population. And I'm particularly concerned about that segment of population which is not aware what the right kind of diet is, which is the middle class, which is the largest segment of population, and also lower middle class and lower socioeconomic strata. Uh, the dietary habits are now so unbalanced in younger people, uh,
Mm-hmm.
that it is very difficult to see how we can reverse this trend.
Right.
Um, the it is We have seen some time back, we did the research, and we have very clearly seen that people know, many people know, that this is the right kind of diet and this is not the right kind of diet. And we asked the youngsters, uh, 10th class, 11th class, 12th class students, and they knew about the diet, but the practices are totally different,
Right.
and practices are totally unbalanced, and that's also driven by the peer pressure. Because if you're going out and you are sitting with 3 4 people at the same time, and those are your friends, uh, and you're sitting in a cafe, you're bound to eat imbalanced diet, you're bound to order more than what is necessary. Alcohol is a part of it, and smoking is a part of it. So this kind of behavior is increasing, though once you ask them what is the right kind of diet, they will tell you that this is the right kind of diet we should all eat. This is also, the dietary practices are also not correct in the household. Um, and there, mainly the mothers which are involved, and the Seema was involved in that kind of research, where we saw that mothers who are healthy and whose diets are not very uh, mothers who are fat and their diets are not very healthy, their children also not healthy. So your question is very difficult to answer, whether we can reverse this trend. We can certainly inform the population, we can make them aware what kind of diet they should have, but whether they will practice it is something totally different. So we have to think of something which is out of the box, something which is new, something which can be imposed in the population. Uh, and there are many things out there. But as far as your question is concerned, this is my answer.
Okay. Dr. Gulati, can you please help us understand what role do you think nutrition plays in a person staying healthy? And at this juncture in time, when we have the kind of lifestyle that we have, at individual levels, what choices on daily basis, what implementable choices rather, we can make that can stay us healthy?
Nutrition certainly has very important role. As we say, we are what we eat, and food is medicine. So if we are choosing our food mindfully, we can definitely, it plays a very important role. We know that diet has important role in energy production, growth, repair, and other bodily functions. So food is very important, no doubt about it. But now, as Dr. Mishra said, the current scenario is like, we are taking more of processed food, processed, refined carbs, and sugar sweetened beverages, etc. So in the light of that, the problems of NCDs, etc., is increasing. So you said what kind of choices? Definitely, we have to swap, say, unhealthy refined carbs with whole foods, sweetened beverages with the natural drinks like lemon water or buttermilk or coconut water. So there are healthier choices, but the problem is the easy availability of unhealthy food items. Now you, as Dr. Mishra said, the teenagers, or the youngsters, they are going out and eating unhealthy stuff, and also they're working late nights. So, and we have apps like Swiggy and Zomato. It's just one, click away. So, in middle of the night, they want to order something. They'll pizzas, burgers, and other foods are so readily available, whereas the healthy options are not that readily available. So
Hmm.
it's question of making healthy choices, and then seeing that healthy foods are available also easily, as easily
Right.
as the unhealthy foods are available.
Yeah. So that brings me to my next question. Making individual choices is one thing, but at the, in our country, we also see, because in the name of promoting businesses, there is this talk about ease of doing business. So, we promote a lot of these companies to which are making these unhealthy foods. So at policy level, when it comes to have a balance between nutrition and also reduce the NCD burden that we have, do you think we are doing enough at the policy level? The government, the policymakers should really make some choices. Dr. Mishra, this question is for you. If you could please answer that.
A difficult question because I will I'm not in the that shoe of a policymaker, and but I have been involved in several documents, national level documents like National Diabetes Control Program document some time back, um, and various other policy level documents, and we clearly have a framework there. We clearly have a framework there. We have a very good document. Uh, we have directive to the medical officers working in the uh, cities, in the villages, ASHA workers, everything. What they should do, when they should tell the people to get checkup done, what kind of diet they should advise, what kind of screening they should have, and once they are diagnosed with diabetes, what are the referral pathways? Everything is there. Very good document. Unfortunately, like many things in India, its implementation remains a problem.
Right.
Implementation on the ground uh, is something which is not the way it should be, and certainly it has the way forward has not been clearly determined. Uh, So, if I were making a document, I will see to it that it is done at the grassroots level. It reaches the services reach those people who need it, and those are the middle class people, lower middle class people, and once diagnosed, what are the pathways for management and treatment? So those are the things which are needed, but many more other things are needed. For example, let's say increase taxation on unhealthy oils and unhealthy foods is needed, and less taxation on fruits and vegetables are needed. This is something which central government can do, and it has been shown that apart from use of front of the package labeling, uh, showing what are the kind of unhealthy choices or healthy choices, and the taxation will bring down non-communicable diseases, including diabetes. This has been shown very well in several countries, including Brazil.
Yeah.
So there is a way to do it. Only thing is, somebody has to have a clear mandate. A committee has to be formed for 10 years, a decade at least, because committee for 1 or 2 years will not do. Once we do the correct thing, the result of that will be available or shown 10 years later. So today, I I do something, decrease the weight of the population as such, the consequence of which will be evident 10 years later that the diabetes curve is going down. So, a consistent and firm policy and its implementation over a long period of time is what is needed.
Yeah. Ma'am, you also mentioned, about the easy availability of, ultra processed food, the packaged food that youngsters so easily can access. What do we do as individuals? And also, do you also have some suggestions for the policymakers in order to reduce their consumption, to reduce our burden of lifestyle diseases?
Yeah. See, uh, one thing is that industry, should also be motivated, or there should be, public-private partnership, and there should be some incentive for the industry also to produce, or to make healthy alternatives available. For example, cutting down on salt, sugar, and so many food additives and preservatives are added, maltodextrin, etc. So many things are added which are so very harmful for us. So there should be one thing, a regulation on the addition of these ingredients in the packaged food, and also uh, this should be incentivized also. Industries who are say using a correct cooking oil, or using less of sugar, or using not using food colors, etc., there should be some incentive to
Right.
encourage industry to come up with the healthier alternatives. Secondly, awareness. Yes, in some section of the society there is awareness, and in some section of the society still, we need to make people aware about the long term impact of unhealthy eating. And also in our survey, we what we found that people, for them, in middle class section of society, if the food is hygienic, it is healthy. Because suppose if you are say driving on a highway or something, you stop at a near at a some roadside dhaba, so you will not get any healthy food there. You'll get packaged foods, and it is safe to pick up a packaged food, considering that okay, it's hygienic and it's good for health. So awareness needs to be given at this level, and also there should be healthier alternatives should be available everywhere, you know everywhere, on roadside dhaba. Why can't we have coconut water, or say packaged buttermilk or things like that? So these are the things which can be done at policy level. One is making changes in the packaged food, and also increasing the availability of healthier foods, then generating awareness among masses through media, and everywhere. It should start right from school. Even if you see in corporate offices, they all know that what is healthy and what is not healthy. Still, if you look at their lunch buffets, I mean, it's like a large spread of unhealthy food items. These are all, you'll
Right.
find all kinds of desserts and juices and things like that. So there has to be a policy at every level. The schools should not encourage the sale of unhealthy food items in their canteens. Even in the colleges there can be some regulation, and in the offices and corporates also. So it has to be at policy level, and of course at individual level. Individuals need to make healthier choices. That may require a prior preparation also, like, because in fast pace of life it may be a challenge to cook every meal. So if there is a prior preparation, suppose you have to go to the office in the morning, and you do a prior preparation at night, or the whole family contributes, these are the things which can help in making healthier choices.
Yeah. India has a unique dual burden of both. On one side, we have a large number of people who are obese, who have obesity problem, but also we have a large number of people suffering from problems of undernutrition, for example, anemia. We have a large number of kids who are wasted, who are stunted. How can that be addressed? Dr. Mishra, would you please like to answer that?
Yeah. It is like that. If you see the current statistics, there is a rise of obesity and decrease as far as the undernutrition is concerned. Uh, the those people who are low in the weight, that is decreasing. So there is some progress made,
Mm-hmm.
and that is a recent statistic, just 1 month back.
Absolutely. Yeah.
But there is a difference between the two. Undernutrition is something which is not by choice, something which is because of low resources, low socioeconomic strata, and poor awareness of what could be healthy food. So, somebody who only has access to, say, rice and dal and no vegetable, a low socioeconomic strata individual will probably have undernutrition. But if this guy or this girl is told that there are healthy choices and there are vegetables which are available, there's a fruit which is available, and you should eat it, and here is the money to eat it, then they will eat it. So that is something which is predominantly restricted to low socioeconomic strata. There is a hardly any individual in the upper socioeconomic strata which is undernourished.
Right.
As far as overnutrition is concerned, people say it is by choice. Well, that's not entirely true. But yes, you have to restrict your choices. So you have plenty of food. You can restrict your choices to healthier options. You do not. And there are other factors which come in: sedentary lifestyle, smoking, alcohol, stress. So overnutrition has multiple other factors. Undernutrition has other factors. The common thing probably which is linking the two is that number one is the poor awareness, number two, the choices which people either do not know or do not make. That is the way. But fortunately, undernutrition is decreasing. And the other thing I wanted to make a point here is that India has a very long standing national program as far as anemia and maternal health is concerned. It's
Right.
running almost 4 decades or more. While the National Diabetes, the Cardiovascular Disease Control Program is something which is a decade old and not yet has put its foot on the ground, feet on the ground. So there's a difference between national programs of the two things. So we are slightly winning the war as far as undernutrition is concerned, and we are totally losing the war as far as overnutrition is concerned.
Yeah, very important point there. So, also, please tell us about, because any discussion about nutrition these days can't be without the role of supplements, because we have a whole lot of supplements which are available. We'll also talk about protein supplements. Dr. Mishra, please also tell us, what role do you think does supplement play in, in somebody staying healthy? in what circumstances should one adopt for it? Because we many a times we say we see people indiscriminately using some of these supplements, especially protein supplements also.
Okay. So if you are healthy, hmm, if you are young, healthy, e- making all the correct choices, you don't need supplement. Period. Increasing use of supplement is largely due to the pressure from the industry. Industry is really pushing, and it's a huge industry, $1 billion or billion rupees, or whatever you want to call it. That kind of industry is, and it is increasing day by day. There's a huge pressure on nutritionists and doctors to prescribe supplements, but there are the conditions where supplements could be of use. For example, let's say a couple of things. One is an elderly individual who's not eating much. Uh, his undernutrition is due to multiple factors, and age is the predominantly driving factor. A person who has been having chronic diarrhea, vomiting, intestinal problem, a person who is uh, by choice taking very low protein and protein is being lost either in the urine or somewhere else, a person who's debilitated, like suffering from multiple diseases or cancer. Now, in such cases, supplements are necessary and could be life saving. Now, one of the recent example of a supplement doing something good is a post-COVID undernutrition and a post-COVID syndrome, where there is a great utility of protein supplements and vitamin supplements because those are depleted during a severe COVID infection. Those are things which we know for last 4 decades. There is nothing new about it.
Right.
But if you take the whole population, say 100 people, then I would say 10 to 15% of the people will really need supplement. 85% of the people will not need supplement. And those of 85, if they are getting supplement, they are getting unnecessary supplement.
Yeah. Dr. Gulati, ma'am, can you also want to add something on, many people, for instance, have micronutrient deficiencies. Are those the conditions when one should consider when taking supplements and shouldn't be used indiscriminately?
See, whole foods are always better, always, because it's the complete food metrics, which will give the complete benefits. Because when you are taking food, you are getting protein, you are getting all the macro and micronutrient, and these nutrients, they work synergistically to give the health benefits. But yes, uh, uh, if you see vegetarians or if you see the Indian population, then we'll see vitamin D deficiency. And because of now environmental changes, also even after sun exposure, also the vitamin D levels remain low. So in that case, supplementation uh, may be
Many,
required.
many,
And
many times people report deficiency of vitamin B12 also in many cases, right?
yes, I was coming to this.
Yeah.
Yeah, similarly, B12 deficiency. So, in specific conditions under medical supervision, the supplements can be taken, as and when required. But indiscriminate use of supplements, and because they are available over the counter and they're taken for long period of time, so there is toxicity also, with excess intake. So these should be taken under medical supervision as and when required, not for a very long period of time. And the best thing is to take a balanced, healthy diet to ensure the intake of all the macro and micronutrients.
That really summarizes it quite well. Thank you so much, Dr. Mishra and Dr. Gulati, for joining us in the conversation today. Thank you so much.
Thank
Thank
you.
you. Thank you.